Hey guys, welcome to another video of Midnight Hill Station. In this video, we'll be talking about the current situations of health workers. We'll discuss about the issues they are facing, who is the mainly responsible for the inconveniences happening in the hospital, a management, doctors or the patients. What are the problems doctors are facing even outside of the hospitals? Watch the video till the end to know the whole current situations of the doctor and other medical staff. The IMA has reported that 75% of doctors face verbal abuse in hospital premises, and fear of violence was the most common cause for stress of 43% doctors. The highest number of violence was reported at the point of emergency, and 70% of cases violence was done by patient's relative. Many health workers in India have been abused in the battle to stop the spread of coronavirus. Report says doctor has been spat at and chased away from homes, and that in one case patient directed abusive and vulgar language towards the nurses. Some physicians and their families has also been isolated by their neighbors because of their exposure to patients infected with COVID-19. One video which has gone viral showed a mob throwing stones to the female doctors wearing PP in the central city of Indore. The doctors had gone to the densely populated area to check on a woman suspected to having COVID-19 when they came under the attack. At the Ghaziabad hospital, some of the quarantined attendees allegedly used vulgar language against medical staff. Some were walking naked in the hospital ward and harassing women doctors and nurses, according to the report of BBC. Even before this pandemic, in NRS Medical College, an 85-year-old man passed away. Following his death, 2 truckloads of people come into the hospital and attacked. 2 doctors were admitted in the ICU with brain injury, numerous others were injured. One of the doctors has his skull fractured, sustained a fracture in the frontal bone. A number of doctors have tested corona positive across India, and that shows that how tough their job is at this moment. And this is why we need everybody's support to win this war against coronavirus.
So what are the issues that doctors are facing? Government is not providing a proper support to them. They are not even getting medical kits for their own safety. India spent only 2.5% GDP on healthcare, whereas other countries spend more than 8%. As we don't have well-developed infrastructure or good facilities in government hospitals, patients have to wait for too long, and this is delaying for treatment. There are limited seats available and patients get frustrated. They think doctors are the main root of cause. In this pandemic situation, some people are treating doctors as untouchables. Maximum doctors are facing these issues. Many health workers have lost their hostels and flats. The bulk of cost of the treatment goes to the management and owner of the hospital and not to the doctors who are treating it. Consultation fees in India is one of the least in the world. One can readily pay 500 rupees for a movie but will still creep constantly for a consultation fees. Indian doctors are the most hardworking doctors in the world. The doctor-patient ratio is 1:1800. That is, there is only one doctor for 1800 people. Due to work pressure, they lack of family and personal life. And there is some Google experts. If anyone could become expert by reading Google, then why they are consulting a doctor? They can do treatments for their own. Patients not bringing their previous records many times, and this leads to delay in diagnosis. Maximum patients even don't know whether they have any other serious health issues or not. Other factors attributed to violence against doctors are absence of postgraduate training in emergency medicine in India, poor quality of emergency care, poor network among hospitals, insufficient skills of healthcare workers, lack of proper training of healthcare staff, and political interference in hospital affairs.
So, what are the precautions we should take to stop this violence against doctors? The number 1. Hospital must be manned with proper armed security guards round the clock. This should be made mandatory like fire safety norms to give permission to any clinical establishment, whether it is a government, private or a small nursing home or a huge corporate hospital. The number 2 is emphasis on proper communication and clear understanding between doctors and patient attendants. In order to develop best patient-doctor relationship, patients must find doctor trustworthy enough to talk about the factors that are affecting their health. Also, at the same time, patient's comfort is important towards the doctor. If you got another point of precaution, write down in the comment section we should take to fight against the violations.
In rural area, there are very few doctors, so patients has to come long way to meet the doctor. The distribution of doctors in town and rural areas should be maintained by the government. The directive of central government states that doctors should work around 48 hours, but in reality some doctors worked 100 hours per week. Overload of work pressures also stressed on doctors. There should be a check on the number of hours worked by the doctors. An overworked doctor would not be in a position to spend enough time with the patient, resulting in misunderstanding. The Union Cabinet from Centre has brought in an ordinance under which any person who attacks a health worker who is treating COVID-19 cases can be jailed for a maximum of 7 years. The ordinance awards the following punishments. In normal cases, jail term is 3 months to 5 years and fine will be 50,000 to 2 lakh. But in serious cases, jail term is 6 months to 7 years and fine will be 1 lakh to 7 lakh. No doctors want his patient to die. His basic motto is save the patient's life. Doctors and society should come together to end this violence.
Doctors and other medical workers are sacrificing all of their comfort zones and working hard for day and night to fight against this COVID-19 pandemic and also risking their lives and families at the same time. They are the white warriors of our society. Although violence against doctors and other health workers is not uncommon, the incident in India seems to be increasing. Many remedies has advised to tackle this situation. Some of those were discussed here as there are certain responsibilities of doctor. Similarly, responsibilities also have been taken by the patients and their relative, political parties, hospital authorities, law-maintaining machineries, media and government to see the healthcare improvement and violence against the doctor. Respect your doctor that they deserve, be more familiar with them and have a good understanding. Medicines cure disease but only doctor can cure patients. Thank you for watching this video. If you like this channel, like, comment and subscribe to our channel.